good morning, everyone, and welcome to the session, Enhancing Your Research Through Multi-Regional Data, working with Health Data Research Network Canada. Thank you for joining us today. This session is designed for you to learn all about HDRN Canada by hearing directly from our various leaders across the network. We'll start with our network leaders providing brief overviews of some of the priority functions and initiatives of the network. Then we've allowed ample time for questions to elaborate on areas of interest to you, our audience. Rather than introduce the entire panel now, we will introduce ourselves as we move through the first part of the session. If you need help at any time, please contact the help desk by clicking on the icon in the main menu on the homepage of the event platform. A reminder that the sessions today are being recorded. Recordings will be available on the ICS YouTube channel post-forum. Closed captioning has been turned on for all sessions today. To start, we have a few poll questions for you on the right-hand side of your screen for polls. Please go ahead and start completing the polls while we get started. And now I'm going to hand over to Raquel Duchesne, who is a Senior Strategic Partnerships Project Manager based at ICS in Toronto. Over to you, Raquel.
So HDRN Canada is a pan-Canadian network comprising member organizations that are actively engaged in its governance and operations. Member organizations, as you can see here, include provincial, territorial, and pan-Canadian organizations that hold health and health-related data for the entire population and or have mandates and roles relevant to HDRN Canada's mission and vision. Can we go to the next slide, please? Great. So our mission is to bring together people and organizations across Canada for transformative and world-leading health data use, with the vision that that data will be used across Canada to drive improvements in health and health equity. And I'm just going to pause for a moment now and see if we've got some answers to our poll questions so we can see better who's in our audience today. So I'm not sure, Anne, can you see the poll answers?
No, I don't think I do see them. Oh, wait, here. Yeah. No, I just see the questions. I don't see the answers. So maybe here we go. Now we got answers. Lovely. We have 55% researchers, 8% healthcare professionals, 3% community members, and 35% other. We've got 43% of people who are not at all familiar with HDRN Canada. 35% are somewhat familiar, 23% very familiar, and we got 20% have seen the website in the past week, 12 within the past month, 8 within the past year, 12 more than a year, 48% never. So we have I would say a sort of medium informed audience, a lot of people who can learn a lot about HDRN Canada.
Great, thank you. So we'll try to have this presentation targeted at everybody here today, and then, like Anne said, we have lots of time for Q&A for all of you. So next slide, please. And I'm now going to turn things over to Jody Gatley, who is a Senior Project Manager with the HDRN Canada Partnerships portfolio, and like myself, she's also based at ICS in Ontario. Next slide.
Thanks, Raquel. HDRN Canada has developed a framework for our work with strategic engagement and partnerships. We engage a wide range of individuals and organizations, including publicly funded researchers, charity and nonprofit organizations, CIHR SPOR-funded entities, the public, research and government organizations, private sector researchers, as well as Indigenous communities and organizations. And the main reasons that we engage are to source and steward data for our member organizations and for research, to translate and share knowledge, to foster the data policy ecosystem and to promote the use of data for multi-regional studies. We engage through a number of ways, including entering into strategic engagement and formal partnerships, providing services, giving and receiving advice, and enabling others. And we measure the success of our partnership work through measuring partnership satisfaction, the collaborative outputs produced, mutual support for organizational goals, and advancements of health and health equity. Our most recent initiative for collective action is the Health Data Research Alliance, or HDR Alliance. This was launched late last year, and it is a forum to work with our partners collectively on issues of shared interest. We're always looking to expand our partnership, so if you are interested or have questions in this area, please reach out. There'll be contact information at the end of the presentation. Next slide, please. Thanks. So the HDR Alliance that includes 7 members currently, including pan-Canadian data holders, end users, and national cohorts. And they'll be working collectively on projects to advance transformative and world-leading data use to drive improvements in health and health equity. Next slide, please. Thanks. So now I'm passing it over to David Yang. He's the HDRN Canada Operations Manager, and he's based in Vancouver.
Thanks, Raquel. Next slide, please. So as you can see on this slide, this is HDRN Canada at a glance. So we as networks of people and organization are working towards a shared goal and have a wide range of initiatives. And these are led by our different working groups and teams, which are formed from representatives from across the country. And these initiatives include the Data Asset Support Hub, the DASH, public engagement, as well as inclusion, diversity, equity, and accessibility team, to name a few. Now, the speakers today will touch on some of them in more detail until the rest of the presentation. So I will briefly discuss about our common data model work. Next slide, please. Now, to support and facilitate multi-regional research, most of us know that data have to be harmonized and analysis standardized within each region. Now, using common data models are one solution to this challenge. This will help produce interoperability and improves transparency and reproducibility of evidence. So we're currently working on is a pilot project with 5 HDRN Canada data centers from BC, Alberta, Manitoba, Ontario, as well as pan-Canadian organizations like CIHI. Now, this project is co-funded by the Canadian Drug Agency Transition Office, as well as internal funding, to work towards a limited implementation of the OMOP CDM, which stands for Observational Medical Outcomes Partnership. Now, this OMOP CDM had been utilized in other countries, including UK, US, Australia, and to name a few, but we haven't really have a pan-Canadian presence here. So our goal is for this project is to plan, test, and undertake a limited implementation of the OMOP CDM that is sufficient to replicate an existing multi-regional project. Now, this replication study will verify the findings, evaluate the value of using OMOP CDM in each of our jurisdictions compared to current existing methods. Now, all of this is to support multi-regional research and to enable Canada to participate more in international studies. We anticipate this work to complete by fall 2024, but we'll have more to share then. And it is important to note that our longer-term goal is to support multiple common data models and other data extraction models. And this is really just the first step towards a larger goal of harmonization. And that's it for me. So next slide, please. And I'll welcome Jordan Hunt from CIHI, who is a HDRN Canada DASH lead located in Ottawa.
Thank you, David. So the Data Access Support Hub, or DASH, is a service for researchers who are looking to access multi-regional data, which you may want to do for a lot of reasons, including examining regional variation, increasing your sample size, or studying the impact of region-specific policies. DASH itself does not hold any data, but it supports researchers through the local, navigating through the local requirements of its 13 partner data centers, providing a single point of contact and making the data access process as streamlined and efficient as possible. And DASH operates in what we call a no wrong door policy. So if you're unsure about what data you need, then contact DASH and we'll help you. If it turns out that a single center like StatsCan or CIHI can meet all of your multi-regional data needs, then your query will be directed there. And conversely, our data centers may recommend connecting you with Dash if appropriate for your study. And Dash is not only about data access, it provides support for grant applications, including doing feasibility assessments and cost estimates. And we provide access to resources and tools like a list of our available data assets and validated health-related algorithms, and these lists are searchable. Next slide, please. So the Dash process is laid out here, not expecting anyone to read it, but the key points are really, there's a single point of contact, you submit a request to Dash, and behind the scenes, Dash coordinates the logistics of scheduling a call with up to 13 data centers, then coordinating the feasibility and cost estimate if required. There's a single data request form, which is then used to sort of trigger requests at multiple data centers, and there's coordinated project management and tracking. So next slide, please. Dash resources are available to researchers whether or not they're accessing data through us. So for example, you can find or access information about privacy and ethics requirements in each region, and information about appropriate consent language, particularly important if you're looking to link your study data ultimately with other data sets. And so if you're interested in doing multi-regional analysis, whether you're ready to make a request or you just want to learn more, visit our website, send us an email, and we're happy to help you. So next slide, please, and on to the next presenter. I will now turn it over to Dr. Georgina Archibald, who is HDRN Canada's operations lead. She is working at the George and Fay Yee Centre for Healthcare Innovation in Manitoba. Over to you, Georgina.
Thanks, Jordan. I'm actually based in Toronto, but work obviously at the University of Manitoba. So the algorithms, next slide, please. Yeah, the Algorithms and Harmonized Data Working Group is one of the collaborative teams within HDRN Canada. It includes representatives from HDRN Canada member organizations, and it oversees the development of data resources for multi-regional research. So central to this is maintaining and updating HDRN Canada's two inventories, the data asset inventory and the algorithm inventory. In addition, the working group develops other resources that facilitate multi-regional data use. So for instance, we're exploring development of a national concept dictionary to host, share, and document standard definitions and codes. So such a platform would expedite study development, it promotes consistency and replication, and really facilitates method sharing among researchers and data centers. Another aspect of our work focuses on data standardization and harmonization. So that includes exploring common data models such as OMOP, but we are also currently piloting MASK, which is an AI-based tool developed at ICES for de-identifying free text health data. And so through a federated learning approach involving training the model at local data centers at multiple HDRN Canada sites, the project aims to develop like a robust de-identification tool that would standardize and improve upon existing data processing protocols, which ultimately would improve research access to valuable free text information. So these ongoing initiatives just offer a glimpse of some of the work that the Algorithms and Harmonized Data Working Group undertakes to foster collaboration and facilitate multi-regional research in Canada. And next slide, please. So I will pass it over to my colleague, Dr. Amy Freer, who is the HDRN Canada IDEA team lead or team chair, and she's based at the Manitoba Centre for Health Policy in Winnipeg.
Thank you. So one of the, next slide. One of the projects that show the collaborative and cross-cutting nature of HDRN's work is our recent project to create an inclusion, diversity, equity, and accessibility strategy. Over the last 6 to 8 months, we have been working together both with the internal working groups and teams of HDRN Canada and with the data centers across the network to achieve this goal. And so we've done informed events to create consensus towards the idea strategy, including focus groups, interviews, and roundtables. We now have a draft of the strategy and are seeking feedback from across the network. And next slide. And just these are the 4 proposed strategies that we hope to make progress on in the next couple years. So around learning and unlearning, facilitating idea and data research, cultivating trust and reciprocity with community partners, and providing leadership and advocacy to forward idea. And so each of these areas will have components that speak directly to the pan-Canadian nature of HDRN's work, and we hope to have more to share on this in the future. Next slide. With that, I will introduce Dr. Jeffrey Bacall, who is based out of the sorry, I can't see it on the screen, Spore Support Unit. Over to you.
Thank you. Yeah, you can go to the next slide. Thanks, Amy. Yeah, so I'll give you a brief overview of the Alberta Spore Support Unit, and it's also Provincial Research Data Services in Alberta Health Services, and so we're one of the regional data centers for HDRN. So Alberta currently has a single integrated health delivery system. So Alberta Health Services operates all the acute health care facilities in the province. And so over the last 15 years of that, we've been building a single enterprise data warehouse. And then in the last few years have invested in a single electronic health record. So it's an Epic-based system that is being deployed at every facility in the province. And so that's really kind of allowed us to have a single data warehouse that's capturing similar data across the province. And so our research data service is integrated into HS, and so that way the analysts are close to the data and close to the delivery system. And so this gives our analysts kind of the best access to the data and then the operations side has access to the analysis work. We also work very closely with the University of Calgary and the University of Alberta, and so we have embedded analysts funded by both those organizations to work on kind of academic work. So it's a very collaborative environment between patients, providers, academics, and through the HDRN, other regional data centers in the country. So all this allows the integration of the data, the analysis, innovation, and care. And so done properly, then research is care. So we can go to the next slide. So in terms of available data, we've got access for most healthcare encounters, including kind of medication dispensation, lab tests, imaging, our provincial emergency medical service, and then the emergency department hospital system. And then we also collect a lot of additional data through the HealthLink system and around childbirth through the Alberta Perinatal Project. And so through all this, data can be accessed basically via our embedded analyst team. So they'll either provide a de-identified cohort if that's what's required for the project. We're doing a lot more analyses in-house, so we've got a lot of expertise there. And especially as we get into the electronic health record data, it's getting a little more complex and a little harder to de-identify. And so our setup, sort of being integrated, allows us to do some near real-time work, including from the reporting side, and then more recently we've been able to do subject recruitment and outcomes for some pragmatic clinical trials. And so you can go to the next slide, and then we will head east, and I'll turn it over to Dr. Ted McDonald, the director of the New Brunswick Institute for Research, Data and Training.
Thanks, Jeff. And I appreciate the comment in the chat about New Brunswick seems to have lost its provincial borders, that we need to fix that. So I'm based in Fredericton, New Brunswick, and I'm the director of MBIRDT. One of the things that we want to do at HDRN is support expanded data acquisition across multiple provincial sites through innovative approaches to either developing or testing approaches to getting new data in individual provinces. And so what I want to talk to you about in the next minute or two is the approach that we've taken in New Brunswick to hopefully inspire other jurisdictions that they could take a similar approach. So as we all know, access to sensitive data is covered by multiple pieces of legislation. And the approach we took in New Brunswick is, rather than go into the legislature and change multiple different pieces of legislation, our government took the approach of crafting an omnibus bill in 2017 called an Act Respecting Research. And what this did was add a provision for data to be shared with NBRDT for research purposes in a linkable, prepared and linkable form. And that particular piece of legislation modified 10 other pieces of legislation. Medicare Act, Right to Information Privacy, Protection Privacy. It was done in a year, and it was done in such haste, government, time-wise speaking, that they missed a few. And so 2019, under a different government, they passed Act Respecting Research Part 2, and they filled in some of the gaps. And this includes everything from Medical Services and Education Act to the Clean Water Act. And what that has meant, and if you look at the graph on the right, the line in black is the number of unique person-level linkable data sets that we have in New Brunswick at NBRDT. And so the taking off points in 2017 and 2019, it's just really skyrocketed. So we have about 110 linkable data sets. And projects have, although we're a pretty small bench in New Brunswick, so our project numbers have increased, but not by the same rate. And those data sets include data from income support and other social services programs, long-term care and home care, workers' compensation. We have K-12 education data that includes kids' attendance, standardized test scores, report cards. We have post-secondary university and college graduation and enrollment data. We have a whole bunch of environmental data, not-for-profit data, data from not-for-profit organizations, and also more recently occupation data. So getting data from regulated occupations such as teachers, nurses, social workers, and paramedics, and that enables us to do a lot of work on health human resources. And so that's the approach in New Brunswick, and we're pretty proud of that, and we're working very closely with HDRN to try and expand the scope of data sets across the province for the benefit of researchers. So I think I'll hand it now back to Anne to take us into the Q&A.
Great. Thank you so much to all our panelists for those brief presentations. And now we'll go to questions. So it's great. We've already got some in the chat. And so I'll start with those ones, but also feel free to raise your hand and ask your question live. I think we are able to accommodate that. So the first question I'll take myself. So how is HDRN funded and how long has it existed? So the precursor group to the current organization was a group called PRIDN. It's a long name I won't say, but that group actually started in 2015. So the sort of, seeds of the current organization goes back as far as 2015. And then in 2019, we actually received the funding from CIHR for the Canadian Data Platform through the SPORE strategy, Strategic Patient-Oriented Research Strategy. And then in 2020, we incorporated as Health Data Research Network Canada. So that's the trajectory. As a result, right now, we are still primarily reliant on the CIHR SPORE funding, but we are always looking for ways to diversify our funding base. So thank you for that question. The next question was, your Canadian map did not put a border between Yukon and Northwest Territories and the borders to New Brunswick. Is this intentional? So the short answer is no, it's not intentional. It was more about stylistic considerations and not a literal representation of the map of Canada. So apologies for anything there. Okay, the next question in the chat is for Jeff. Do any of the data sources for Alberta SPORE include patient-level equity sociodemographic data?
Yeah, so good question. I mean, we have a few proxy measures that we use. I think in most cases, we're generally linking postal code to, postal code to census data is kind of our best estimate there. And then, occasionally through some of the diagnostic coding and other stuff in the hospital, we can figure some of that out.
Great. Thanks, Jeff. So the next question is, do you provide data access to the private sector? So this is an interesting one. HDRN Canada, through the DASH service, we do not serve the private sector currently through the DASH service, primarily because of the CIHR. The DASH is essentially funded through that CIHR SPORE grant. So it does not, it's for, publicly funded researchers and not the private sector. Having said that, many of our sites, our member sites, do actually serve private sector, including ICS, for those in Ontario might know more about that. But I'm going to let both Ted and Jeff also speak to this, because I think both their sites are involved with private sector work. Ted, do you want to go first?
Yeah, thanks, Anne. Yeah, many of our provincial sites do work with private sector. The terms in which that occurs vary from jurisdiction to jurisdiction. Sometimes it's arm's length, sometimes private sector can initiate projects. So it does vary from province to province. One of the things that we're looking at HDRN is the extent to which we can collaborate across provinces involving a coalition of the willing. Again, every one of our mandates there's a public interest test. We have to, whatever work we do that uses sensitive data has to be for the benefit of our citizens. But with that, given that, then many of us do, and we want to kind of streamline that, especially when it comes to things like rare diseases, where you need to pool a large population, you need to pool across a large population to get meaningful results. Jeff?
Yeah, I mean, pretty similar answer from our side. It really depends on the project. We have a few initiatives that work with private industry. Usually it's either through like a real world evidence unit at one of the universities or something like that. But again, we're really trying to maintain that public benefit.
Great, thanks both. So the next question is, how are data harmonized in each partner? Are they in common data model format that has standard structure in all partners and saved in each partner service, not centralized location? So David, do you want to take this one?
Sure, thanks, Anne. And I'll allow Jordan and Georgina to add any further information as we need to. So at this current moment, I can speak to the pilot project. We're discussing exactly how this DDM format will live within each of our data centers, because our data governance structure is different across our provincial sites. They would, at this point, would have to create standard structure within each of their, either a new data holding or data asset within their secure research environment in their own site. So we're not going to have a centralized location at this point, with lots of limitation legislative barriers. But as we move towards the future, we might have alternative ways of how we can do that. For example, federated analysis, to be able to have this more pan-Canadian picture and an easier way of analysis. So at this current point, we are creating a standard CDM format within each of our sites. So Georgina and Jordan, you're welcome to add more if you like.
Sure, thanks, David. I think it varies. The terms of how data are harmonized, it varies by data holding. You have standardized or harmonized data sets like the discharge abstract database that would be in generally the same structure across all of our sites. We have some further harmonized multi-regional data at our pan-Canadian sites like CIHI and like StatsCan. There is some CDM common data model work that's going on that David alluded to. And then lastly, just to say that if there is a multi-regional request, the data are presented to the researchers ultimately in a harmonized fashion. So it's not left for the researchers to analyze the data from the source formats, and we're working on our processes for that to make that as efficient as possible and as repeatable as possible. So we're not starting from scratch, aligning our data sets on a query by query basis.
Awesome. Georgina?
I don't think I have anything else to add to that.
Awesome, thank you. So next question is for Jeff. Is Alberta collaborating with any other Epic-based hospitals across Canada?
Yeah, so for us, I mean, we did definitely worked with a few on our implementation side. On the data side, we're still really in the early stages for us and trying to get our own data clean and get the quality up and that kind of thing. And then I think ultimately we would, be interested in that, and that'd be somewhere where, again, we could look to a common data model setup, right? We still have the problem that even if we're both on Epic, we still struggle to share data between provinces.
Yes. Okay. Please continue to put questions in the chat or raise your hand. In the meantime, I've got a few for the panel myself. So I'd like to put to the panel, maybe starting with Ted, but anyone else can join in as well. Why is multi-regional research so important? What are the advantages of multi-regional versus single jurisdiction?
I think the first, probably the most obvious reason is that we don't have a Canadian health system. We have 13 different health systems which have developed and evolved very differently over time. And there's a lot of interesting work going on in each province. And so the ability to compare across provinces and have other similar provinces as control groups. So we have some work coming up now that's just been CIHR funded, looking at alternative payment models for physicians. And New Brunswick, with it's predominantly fee-based, we've had very little change. We become a control group. So one of them is just the ability to control, to compare different kinds of innovations across provinces. And another, as I mentioned in my earlier comments, just about we might have a large population, but if you're interested in rare diseases where the incidence is very rare, you need an entire population, national population, to do meaningful statistical work on that. And so so having just Ontario and BC perhaps is just not enough. So those would be two reasons, but lots of people, other members of the panel, I'm sure, have other ideas as well.
Anyone else want to chime in on this one?
Sure, I'll go ahead, Amy.
Yeah, no, I was just going to say, like, jumping off of what Ted said, part of what can also help in terms of cross-regional research is looking at equity between provinces as well. So we know that there are differences in regions and how healthcare is delivered there, but that can also give us a good picture in terms of equity of healthcare, not just within a region, but in a cross-regional sense. The other thing that I'll expand on as well with Ted mentioned rare diseases, but there are certain populations where we think of equity considerations where we might not be able to look at those populations within one jurisdiction, knowing that their population size is too small. And so when we have cross-regional groups, we can look more cross-cutting at different populations when we think of things like disaggregation, so sex and gender, race and ethnicity, disability, income differences, etc.
Jeff, were you gonna chime in?
Yeah, I think, again, kind of on the similar vein, right, is we also, nationally we have a lot of different we've got different hospital system setups, different geographic differences, right? Like for, some places have one major center, some have a whole bunch. And so, from understanding, again, changes in care and that kind of thing, it becomes, it becomes like a multi-center clinical trial, right? You need to know what's happening in your area and others to see what's actually driving things.
Right. Thanks for that. Amy, question for you. Could you elaborate a little bit on the type of supports that researchers might expect from the upcoming IDEA strategy, supports that would enable them to do, equity-related research?
Sure. Yeah. So two things I would highlight here would come from one from the facilitating idea in data research. There are already tools across our network that are used within provinces. And so one thing that we can do is to kind of scale that up to what might the considerations be different for doing cross-regional research. And one example I can give is ICS has guidance on using race and ethnicity data. And our considerations might be, what other considerations do we need to think of when that guidance is put in a cross-regional setting? One other thing that I think will be very valuable is we've been talking a lot about data biographies. So having better documentation about who collected the data, why it was collected, what questions were used, and when variables change when over the course of that data set's lifespan. And so this would be helpful for researchers when we think of recent conversations around sex and gender data, that different variables are being added or removed in different jurisdictions as these conversations evolve, and having a way to track that would give that richer context to researchers to say, okay, we know we're not comparing one thing to another when we're thinking about diversity and equity within these data sets. And so those are just two things, many other projects to come.
Excellent. Thank you, Amy. So next I have a question for Jody on the strategic engagement and partnership side. Can you elaborate a little bit on the sorts of partnerships that we have that relate to sourcing and stewarding data? And also maybe elaborate on how anyone who might be interested in a partnership, how they could get in touch with us.
Sure, thanks, Anne. So one of our recent really big successes with partnerships in terms of stewarding data has been with the CLSA cohort, the Canadian Longitudinal Study on Aging. And the partnership actually started, I think, way back in 2021, long before I joined HDRN, but there was a steering committee formed with representatives from CLSA as well as from all of our members at HDRN Canada. And we worked together to develop data sharing agreements with each member organization so that they could receive a cohort of the, receive a data set for the cohort data in their own province. So currently, I think there are 4 provinces currently that have linked data available, Ontario, New Brunswick, British Columbia. And I think there's one other that was close. I need to double check who that is, but contact me if you have questions about that. And we're also working with the IRCC, so that's data on permanent and temporary residents in Canada, and looking at expanding that. So that's currently available in Ontario, New Brunswick, and I think BC, but we're also looking to get additional provinces participating in this program.
Great, thanks, Jody. And there's in the chat is Jody's email for folks that might want to follow up on partnerships. So Jordan, a question for you. Knowing that you know, we have to respect each jurisdiction's local policies and procedures with respect to data access, how does the DASH team work to make data access approvals easier for researchers?
Yeah, I think it's really trying to be transparent about what those requirements are, be very clear, and provide those resources in our sort of single form. So even though behind the scenes we're following, as you said, up to 13 data access policies and procedures, we're trying to present as much as possible a single view to the researchers, so they don't need to worry about you know, what all the requirements are. They're also, or they don't have to chase them down, I should say. They're all there presented to them. And again, I think the most important thing is that single point of contact, that, you know, all the coordination of getting the multiple data centers together is handled by DASH, and that they're just showing up for one meeting or providing one set of information, and we're making sure it gets to where it needs to.
Right, and there is some really good, there's some really good resources on the Dash website that Kate has been putting in the chat about where you can actually see by jurisdiction what the requirements are. So definitely do check out our website.
And I guess, sorry, and if I could just add one thing too, that's
Yeah.
sort of what we're doing now, but as a longer term goal, we are also, working on some of the differences in policies and procedures across the jurisdictions and where we think we can make changes or make things more aligned. We are working as a collective on that as well.
Awesome. Okay, so question from our audience. Are you able to track gaps in data based on the requests that come in and potentially summarize those recommendations to the data holders? So I'm going to, this one is, I think, both Georgina and Jody could probably help with this, and maybe Jordan as well. I don't know who wants to start. Jordan, do you want to kick off in terms of the initial interface, and then we can add what we're doing in this area?
Yeah, so certainly we do sort of track what's initially requested in our inquiry form, and then we know what ultimately went out. I think we could, we're probably working on how to sort of systematically share that information, but as you know, and maybe I'll speak to better, we are working as a collective in HDRN on sort of a data advancement strategy, if that's the right word, and feeding into how we prioritize those data priorities, I guess, those data acquisition pieces. This would be a part of that. What are researchers asking for?
Yeah, so Jody, do you want to speak to what we're doing in the area of data asset expansion?
Sure. We've recently convened a data asset expansion working group that includes several HDRN members, and yeah, we're still in early stages, but we're planning to connect with all of our member organizations to evaluate or find out what are their own strategies, policies, and processes for identifying data assets to bring in, and do they have sort of set guidelines for how to prioritize data, or is it sort of just what's being requested by researchers the most, or basically just having a scan across the network of how that's being done, organization to organization, and then creating a larger sort of prioritization strategy for HDRN Canada as a whole that could help guide members, although also recognizing that they can make their own decisions according to their policies as well. And part of this will also be a scan of the data holdings across HDRN Canada, identifying the gaps and sort of categorizing data into things like, the core healthcare use data versus social determinants of health data, and identifying the gaps in each of those sort of categories of data to also help us prioritize where to go next.
I muted myself. Ted?
Yeah, I can add that I have actually used this approach in my province because the data sets ultimately are provincial data sets. The data have to come from provincial data custodians. And so opportunities to be part of multi-jurisdictional research where New Brunswick isn't able to because we're missing either a data set or the data sets that we do have are not up to date. I can bring that back to our data custodians and say, this is an opportunity for New Brunswick to be part of a multi-jurisdictional research project. If we can get these data, then we can be part of it. And that means investment, but it also means knowledge benefits for New Brunswick. So it goes both directions. And in that way, we can really encourage data preparation, because I think provinces always hesitate to be first. They also don't want to be last. And similarly, where we have done something innovative, for example, the health human resources data, the approach that we've taken, we can advocate up, and then the other provincial data centers can take it back to their jurisdictional partners and hopefully get some take up there.
Awesome. Thanks, everyone. So in the previous session, there was a session about the ICS ARC program. So I'm wondering if, Raquel, if you could speak to whether HDRN Canada does anything similar to the ICS ARC program.
Great, thanks, Anne. So ICS Canada recently undertook a project in partnership with CADITH and sponsored by Health Canada Sedato branch to look at developing a service that would provide multi-regional data analytics to pan-Canadian pan-Canadian organizations. So similar to the ARC program that is really targeting at decision makers, we're looking at how can we best provide data analytics services to decision makers more at the pan-Canadian level or maybe at a multi-provincial level. So that's something to stay tuned for and hopefully will be rolled out soon.
Awesome. Thank you for that. So back to Georgina. I'm wondering if researchers are interested in having particular algorithms developed or validated, is there like a pipeline for researchers to approach HDRN Canada or somehow engage to let us know of their interests in terms of algorithms that would be of particular value to their research?
Yes, I think we're always scoping and looking for new algorithms that are validated or tested for feasibility in 2 or more provinces or nationally. The inventory, I think currently some of that process involves doing some literature reviews, a systematic literature review, but there's always an opportunity to approach us. You can go through the general HDRN Canada email. You could also email me or Lisa Lex, who's the chair of the Algorithms and Harmonized Data Working Group.
Awesome. Thank you so much. And over to David Yang. So when, as a researcher, when could I expect to see common data models available for researchers through the DASH?
That's a great question, and I don't have a short answer to. At this point, we are just a pilot project. We're only doing a limited implementation of only about 7 data tables of the OMOP CDM. So really on the initial phase of testing whether there is value and benefits within their jurisdictions and figuring out the actual feasibility to operationalize this. So it will take years, I suspect, to be able to be launched on the researcher side. But we are working on other ways of data harmonization that could ease that process at this point. So think more to come, but at this point, I don't have a final answer.
Thanks, David. And so now I want to go back to Ted and Jeff with a very sort of practical question. If I'm a researcher and I want to include New Brunswick and Alberta in my research project, will I be accessing the data remotely from Ontario, or how will that work? Maybe Ted, you could, or Jeff, go ahead.
Yeah, I mean, so for us, we are right now, we'd probably be looking at either doing the analysis in-house, or we could set up a data transfer agreement for some sufficiently de-identified data. Coming soon will be so we're moving our data warehouse into the cloud, into a Snowflake instance, and so part of that process is going to be basically setting up a remote, secure compute environment in that instance.
Awesome. Thanks, Jeff. Ted?
Yeah, same here. As it is now, you need to be on site in one of our secure facilities. If you want to do your own work, or you work with us, and one of our analysts will do the actual number crunching. But we are developing a remote access hybrid model similar to what Jeff described, where approved researchers with approved projects and approved data elements will be able to access remotely. It's probably going to be limited to Canada, so not internationally, but I don't think that you don't need to be physically resident in New Brunswick to do that. So we hope to have a prototype running towards the end of the year for that.
Awesome. Okay, back to David Yang. I've heard of this program called the Pragmatic Trials Training Program. I wonder if you can tell me what that is, and as a researcher, how I would engage with it.
For sure. So we have recently received a small grant from CHR as well to develop this pragmatic training trial. And this is led by Taylor McClinton, located in the Western Schulich Medicine. So what this is we're developing a program for postdoctoral fellows, highly qualified personnel, as well as trainees, to develop the skills and the resources they need to participate in pragmatic training trials. And what pragmatic trials are is clinical trials using routinely based data, all the data we're talking about today, the administrative data, that can give us more real-world evidence. So the application process has already been completed. And we have about, I don't exactly remember the number, but you can see the website, you will see we have over, I believe, 90 or so applicants within this program. And we're developing the curriculum, and it will launch shortly to the wider audience. So we'll more to come once we have this program launched and ready to go. But all of this is trying to develop skills and within our user community to use routinely based data in clinical trials.
Awesome. Sounds like a great program. Thank you. And so, Raquel, back to about HDRN Canada. I understand there is a public advisory council. Could you tell us a little bit about the Public Advisory Council?
Sure, thanks. So the Public Advisory Council is made up of 12 to 15 members with different backgrounds and experiences. So we have representations from different ages, genders, identities, occupation, language, geography, etc. They do meet quarterly, and they try to have one meeting in person, and they also host a free hybrid public forum annually. So do keep an eye out for that. I think the one for this year, unfortunately, it's just passed, but they collaborate with HDRN Canada's Public Engagement Working Group, and they produce webinars, materials to educate and engage with the public on a range of different topics related to health data.
Great, thank you so much. And so I also want to, maybe I'll just take this one, is the work that we are doing around federated analysis. So you know, as we have described, you know, at the moment, data resides in, you know, all the different provincial and territorial data centers. And so HDRN Canada is really focused on how do we make it easier to analyze data across these different data repositories without actually data moving between locations. And so the one initiative which is already live, and you can see the chat in the chat that Kate has shared, we have a learning series on federated analysis, state of the science. And so there are still some upcoming events, I believe, in that series, and I think it will become more or less an ongoing series. So this is where you can learn all about the latest science and methods and considerations in federated analysis. So it's a really great opportunity. And then as part of this, I mean, HDRN Canada is continually trying to improve our policies, processes, and our computing environments in order to enable this kind of work to be easier and easier. So just to let you know that we are very much on that mission. I don't know if anyone on the panel wants to elaborate on that work on federated analysis. Okay, and then Kate, I'm going to ask you to just briefly speak to the communications team and the work that we do, other events that we host regularly, our newsletters, etc. How can people engage with us through that avenue?
Yeah, I've just dropped the link to our newsletter data points in the chat. Would love for you to subscribe, and then you'll find out about all of our various events, our publications, where our folks are presenting, events like this, collabs with our partners such as CLSA. So we do have an event called Federated Analysis Collective Learning Series. The next event is next week. I've dropped the Eventbrite sign up link for that in the chat. We also have another series called Big Ideas about health data, and that is our idea-related speaker series, which has been very popular. We just launched in the past fall. And then we have other various one-off events. Our public forum, like Anne mentioned, just happened last week in Montreal and online, and that's an annual event to engage the public in various burning issues and urgent, ideas around health data and how the public can be involved. So we are doing lots. We're always doing more. So sign up to the newsletter and you will always be informed of what we're up to.
Awesome. Thanks, Kate. Well, I'm going to wrap up now. I want to thank our panel and our communications team who supported this whole event, and our audience for an informative and engaging session. If you have not visited our new website, you've got all the links now in the chat to point you directly to the areas of interest. It really does have some terrific resources. And so next is the lunch break. So you can join one of the virtual lunchrooms if you would like to network with other attendees. There's a widget to access the lunchrooms on the main menu. And then we look forward to welcoming you back for the keynote with Dr. Tara Kiran at 1 p.m. So with that, I will thank everyone again and see you probably somewhere in the afternoon sessions. Thank you.